Lecture 15, Infections of the Genitourinary System. As always, we start with anatomy part, and a genitourinary system actually is a set of two systems that are related anatomically but have completely different functions. It is a reproduction for reproductive system and excretion of waste for urinary system. And we start with the anatomy of urinary system. The functional unit of urinary system is glomerulus. Glomerulus is a cluster of the blood vessels, and when blood goes through glomerulus, it gets filtered under high pressure. And then the end product that comes out of glomerulus is called filtrate. And then the filtrate passes through the series of microscopic tubules. And when filtrate passes through those tubules, some of the substrates will be reabsorbed back into the bloodstream, and some will be excreted into what we call urine now. And then urine flows into what we call urinary bladder. It is a sac-like structure, and the function of the urinary bladder is to store urine. And then urine leaves a urinary bladder through urethra. You probably remember from anatomy class that female's urethra is shorter and a little bit wider compared to the male's urethra, and that explains why females are prone to urinary tract infections more often than males. And the reproductive system. Female's reproductive system is composed of two ovaries, left and right, and this is where eggs are produced, and then egg passes into uterus through fallopian tubes, and then uterus ends at the neck-like structure. We call it cervix. And the male's reproductive system is composed of testes, left and right, and their function is to make sperm, and the several glands. We start with normal biota of genitourinary system, and you probably remember we already talked about it on previous lectures that the only area where normal biota in a female's reproductive tract can be found is vagina, but not too many organisms. In the urinary system, the only area where normal biota can be found will be the lowest third of urethra. Because the genitourinary system transports materials from inside of human body to outside, this system is not getting infected as always as, for example, respiratory system. But sometimes infection might happen, and few examples of how it can happen are listed here on the bottom of the slide. For example, genital childbirth, non-sterile abortions, sexual intercourse. So how is urinary system, how is it protected? Urinary system, for example, aligned by the epithelial cells that are very close, very tight to each other, and also they're resistant for bacteria, for attachment of bacteria. Also, urine flows, when it flows through the urinary system, it removes microorganisms from the surfaces. And as you remember, female's vagina has a low pH, which is created by Lactobacillus species. And as you remember, Lactobacillus species growth is supported by estrogen. And we are going to start with urinary tract infections, or UTIs. UTI, it is infection of any part of all parts of urinary tract. The most common infections are called cystitis and urethritis. Cystitis is inflammation or infection of urinary bladder, And urethritis is inflammation of the urethra, mucous membranes of urethra. The symptoms of those two UTIs are very similar. It is frequent and painful urination. Some patients might also complain on abdominal pain and low-grade fever. The most common cause of UTIs is Escherichia coli, but other bacteria also can cause urinary tract infections. For example, Proteus species, Klebsiella species, and Pseudomonas species. They also can cause urinary tract infections. When infection goes further up and affects kidneys, we call this infection pyelonephritis. And the main symptoms of this infection will be fever and pain in the back. And as you see from the slide, again, the most common cause of pyelonephritis is Escherichia coli. Also, please remember, UTIs can be caused by any interference with normal flow of urine. For example, elderly patients, male patients with enlarged prostate, very often they develop symptoms of UTI. Spinal injury, another example of a problem that also can cause UTI. And as I told you before in the previous lecture, the most common cause of UTIs in the hospitals will be catheterization. How do we diagnose UTIs? The diagnosis is based on clinical history, patient's complaints, physical examination, and of course urine analysis. There are different types or kinds of urine analysis we can use, and usually we start with dipstick. Dipstick can detect white blood cells, red blood cells in the urine, nitrites. And then the next test that we usually go with is microscopy. And microscopy gives us a little bit more information. It can give us the number of white blood cells that can be found in that urine, red blood cells, and also we can detect bacteria using this test. But the definitive diagnosis of UTI is based on results of culturing of the urine. So if our patient has more than 100,000 colonies in 1 milliliter, and especially if patient has more than 2-3 different kinds of organisms in the urine, that means patient has UTI. Treatment of UTIs. First of all, frequent urination can control the infection. So we know that those patients should drink a lot of water. The second part of the treatment of UTIs will be antibiotics. And usually the choice of antibiotic that is going to be used for treatment of UTI is based on experience of physician. Why? Because usually it takes a while, about 2 weeks, 10 days or 2 weeks to receive results of culture of the urine and the sensitivity test results. So during those first 2 weeks of treatment, as I said, usually choice of antibiotic is based on experience of physician. And then after a physician receives results of sensitivity test, then he can switch to other antibiotic or stay with what he chooses in the beginning. As I said before, E. coli is the most common cause of urinary tract infection. And I also told you that UTI can be caused by Proteus species, Klebsiella species, and Pseudomonas species. What you have to remember about Proteus and Klebsiella species is they actually can make urine alkaline. So that can lead to kidney stones. So we can say that Proteus and Klebsiella species have ability to cause kidney stones in the patients. The next infection we're going to talk about is leptospirosis, caused by Leptospira interrogans. Leptospira interrogans is a spirochete. It is a very small bacterium. It's barely can be seen under microscope. Has a lot of requirements for growth. So basically, the way how we can diagnose this infection is by using immunodiagnostic test when we're looking for presence of antibodies to this bacterium in a patient's serum. Leptospirosis is a tropical infection. The source of infection will be animals, for example, cats, cattle, rodents. People usually get infected through contaminated water or soil, and usually people get infected through the mucous membranes or lesions on the skin. Many people infected are asymptomatic. That means they do not produce any symptoms. And a lot of people also, if they produce symptoms, so those will be flu-like symptoms: fever, headache, muscle pain, redness of the eyes. But there's a 10% of mortality rate for this infection. In this case, infection goes systemic and affects and causes damages of the liver, kidneys, rash, bleeding, shock, and this usually form of leptospirosis is a deadly one. For the treatment, we're going to use antibiotics, for example, penicillin or tetracycline can be choice of drugs.